Good morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
Well, good morning. Welcome back to Insurance Matchmaking. Today, we're going to talk about hidden gaps in Medicare that can cost you thousands. You know, and y'all hear people say, hey, I've got Medicare, I'm covered, right? Medicare is good. It's not complete. And today we're going to cover what's not covered. It's funny, I just realized we're going to cover what's not covered. All right. So part of the big misunderstanding, sometimes people don't even, just the basics. I go over this. In fact, actually, I did, a Medicare seminar this week. I've got some video. I got a video now that kind of does our Medicare 101. So if you just want to know about that, just let us know. I don't have all the links up for some of that stuff, so it would be one of those. If we have a book out now called 64 Plus. I can email you an electronic copy of that if you're interested too. But right now, you just need to let us know you're interested in it. Eventually, we'll have a link up, and you can just go there and download it from there. Of course, Medicare, what we call original Medicare, the government Medicare. That's that red, white, and blue card that you get when you turn 65. And I say get, you don't necessarily get it automatically. We've covered that in some other shows. But Part A, that's your hospital coverage. And in Part B, a lot of people say doctors. I always like to say it's everything except for being in the hospital, except for your prescription drugs, because that's D. But there's gaps there. So with the Part A, and this is what I always tell people to think, well, like we said in the beginning here, it's like, hey, I've got Medicare, I'm covered, right? Well, yeah, you're covered, but it doesn't cover everything. Part A, hospital coverage, great coverage, so you don't have to worry about having co-pays, at least not if you're only in for a few days. But you are going to have a deductible when you're admitted in the hospital. And that hospital deductible right now, that's $1,736 in the year 2026. It generally goes up every year. So if you're listening to this on YouTube or podcasts, you're going to have to take into consideration if it's a different year, it's probably a different amount. But anytime, this number will not change before the end of 2026. So if you're listening to it, fairly recently, after me putting this out, it'll be the same. It doesn't change. They change, and we usually don't find out till sometime in November. Sometime, I think this year it was almost December before we actually found out what the Part A deductible, and the Part B premium and all those things would be come 2026. And which is really frustrating because we start the Medicare, enrollment season October 1st, and we can't tell people what it's going to cost them on the government side until after we've already met with them. We have to follow back up and say, oh, by the way, this is what your Part B. We usually have kind of an idea, but I hate to put those out because in last few years, it's been way off. This year actually was pretty close, but a couple of years it was way, way off. So anyway, Part A, you do have that $1,766 deductible, $1,736 deductible, and that's not an annual deductible. I know if you've listened to my show for a while, you've probably heard me talk about that. But that Part A hospitalization deductible is not an annual deductible. It's a per hospitalization. Now, good news there is when you're discharged from the hospital, if you go back in the hospital within 60 days of that discharge, you're still considered in that same benefit period. So you wouldn't get hit with the deductible again. But these are some gaps, and this I'm talking about, we always tell people, this is why you don't want just Medicare. You're going to want something to go alongside that. Part B, as we've mentioned many times on this show, there is a premium for that. Part A, fortunately, you can avoid paying a premium on that as long as you've worked your 40 quarters and paid into Social Security and Medicare and all that. Part B does have a premium. Currently this year, it's $202.90. Might as well say $203. It's just a dime short of that. And then it has a deductible also. Now, the good news is with Part B, it is an annual deductible. And that's currently for 2026 is $283. When you go to the doctor, now, preventive stuff is covered. I always want to make sure people are clear on that. I had a phone call yesterday. Somebody was like, well, we got a bill. It's like, well, you have a deductible. And they're also on a Plan N. And Plan N, there's going to be copay. So there's after the deductible. So that could have been that. So if they got a bill, it probably wasn't much. It should have been less than $283. So, but if you're preventive, you're just going for your annual checkup, you're used to not paying anything, and then you get sick. My youngest grandson right now is recovering from strep throat, so those things happen. You have to go to the doctor because you're sick. Get a sinus infection. You think you got the flu. You twist your ankle, whatever. You're going to go to the doctor. Now, with the Medicare Advantage plan, you may have a zero copay at your primary doctor, but there's copays at urgent care. If you have a Medicare, if you have just Medicare A and B, you have to have met that $283 deductible before Medicare starts paying anything for that. And if you have met the deductible, Medicare is only going to pay 80% of the cost. So you are still going to have a 20% left over. And that's one of the things we talk about, the gaps of Medicare. Those are kind of the big gaps, and that's why we come up with what's called the Medigap plans, the Medicare supplements. They will pick up. I mentioned just when I was talking about this client that called in has a Plan N. Plan G and Plan N will cover that hospital Part A deductible. They do not, none of the plans. If you're new to Medicare now, you can't get a Medicare plan that doesn't cover a Medicare supplement plan that doesn't cover the Part or does cover the Part B deductible. You're going to have to pay that before the supplement starts kicking in. The other thing with the supplement, they're great. It's not your primary insurance. And if it's something that's not approved by Medicare, your Medicare supplement isn't going to pay it either. So that's something you got to be careful about. And that's why we generally recommend people get a Medicare supplement to cover those big expenses that might come up. Some people's like, oh, I never go to the doctor. I don't want to pay anything. Hey, that's where a Medicare Advantage could be a great fit. It just covers that. So you do have a maximum amount of pocket protection, but you're going to deal, now you have to deal with the networks and such. And we always, you've maybe heard me talk a little bit recently about our umbrella coverage as something in kind of a new concept, new way we're presenting that. We never recommend a Medicare Advantage without some type of umbrella plan put in place, because you're going to have still going to have a lot of out-of-pocket exposure with that Medicare Advantage. So things that are not covered by original Medicare, crowns, dental work. Original Medicare, we talk about the DVH plans, dental, vision, and hearing. Hearing aids could cost you $3,000 to $6,000. Medicare Advantage is going to cover a lot of these things, but there's going to be some limits. And actually, I'm finding that out right now. And maybe you've heard me talk about, I have, kind of an unusual situation or not a typical situation. There's a lot of us out there, but it's not typical for the general public. Because I retired from the Army, I also have what's called TRICARE. When I turned 65 and went on Medicare, I got TRICARE for life. That works like a Medicare supplement. But again, it doesn't cover dental, vision, or hearing, or any of those things. So I did put in place a Medicare Advantage plan to fill some of those gaps like the dental and the vision and the hearing that aren't covered by Medicare and aren't covered by TRICARE. So I have to get 2 crowns. And so with that, plus couple other fillings, I guess, as you get old, your teeth just start falling apart. It's over $2,000 worth of coverage. Now, of course, you get your treatment plan, and I'm still going to have to pay over $500. But the beauty there is, I'm saying, with my Medicare Advantage plan, I'm not paying a monthly premium for a dental plan. I sold myself a dental plan before I was on Medicare. Once I went on Medicare, I canceled that plan using my Medicare Advantage plan, but I do have a 20% coinsurance on that. But if I hadn't had that, I would be billed that over $2,000 for the dental work. So that Medicare Advantage plan right now is coming in very handy for me. So the other thing that we talk about is in the hospital, and you're in what they call observation. You can be in the hospital for a week and never actually be admitted to the hospital. And that can rack up some costs because you're going to be billed a little differently for the hospital stay. That Part A deductible never came into play. So you're probably going to have some Part B costs for each of because that's basically, it's considered outpatient. If you're there under observation, it's outpatient. So you're going to have a 20% charge for each day. Now, of course, if you have Medicare, you're going to pay 20% with your Medicare. If you have Medicare supplement, then you are going to pay it's going to cover that 20%. In Medicare Advantage, generally, what way I've seen it happen with the Medicare Advantage, it's still basically the same copay as if you were inpatient. They're still going to charge you the per day on that. I believe it's the way they're doing it. Or they may charge it as they may charge the 20% as just outpatient, and that adds towards your maximum out of pocket with that Advantage one. That's one of the downsides. Another gap, so to speak, with a Medicare Advantage is you do have a maximum out of pocket. I mentioned if you're admitted in the hospital, you're going to have copays per day. And again, one of those reasons why we never recommend a Medicare Advantage without the umbrella coverage, because we can help cover up those big out of pocket costs. So the other thing is, the big thing here though is when you're in observation is your rehab eligibility. Usually when people are in the hospital, but they're going to need some rehabilitative help after they get out of the hospital, they get sent to a skilled nursing facility. But the drawback there is Medicare won't cover that skilled nursing facility unless you've been admitted to the hospital for 3 days. And now 5 days in observation don't count towards that. And again, as I mentioned just a bit ago, that if Medicare doesn't cover it, your Medigap plan doesn't pick it up either. So you could be so you have to be very careful. And unfortunately, this happens. It doesn't happen. I haven't seen it happen a lot now. There was a few years ago. It was kind of an epidemic that people were ending up in the skilled nursing facility, but didn't have their 3-day hospital stay, and then got the bill later. And of course, when you're hurting, you're sick, you're wanting to get better. You're not thinking about, is my insurance covering it? You're just kind of assuming that it is. You got to be careful on that. But if you're admitted, if you're not admitted, that rehab's denied. As I mentioned, you're looking at a big bill. So those are some of the things. Now, one of the things again we talk about, we never recommend a Medicare Advantage plan without a umbrella coverage. Also, some of that umbrella coverage plans can help you, again, also with a Medicare supplement. We generally don't do what we call the hospital indemnity plans with a Medigap plan, but you can get one. There's nothing saying you can't have it. The neat thing with those plans, they're going to pay you because you were in the hospital. You can get, I think it was a UB04 form from the hospital that'll show all the treatment codes, and when you entered the hospital, like I said, I almost said admitted, when you entered the hospital and when you left the hospital. In many of the hospital indemnity plans, we'll still reimburse those days for the hospital stay, even if it's not covered by your Medicare, or even if it is. That's the beauty of the hospital indemnity plans. And I've used the term, I know I always say, it's a big word that means it pays you. So if you got a plan that says it's going to pay $300 a day or $450 a day for 3 days, 5 days, 6 days, whatever the number you request, they're going to pay you that much for those days, regardless if insurance covered it or not. It just requires that you had the billing to show that you were in the hospital. So that's something that can be a big help. I'm going to talk about as they say, the 100-day myth. We'll cover that after we break here for the commercials, and I'll be right back on that.
Life moves fast, even here in the Upper Cumberland. Is your internet and wireless keeping up? More families are bundling Twin Lakes Fiber Internet with Tri-Lite Mobile for faster speeds and dependable coverage. Right now, get your first Tri-Lite Mobile line free for an entire year. No gimmicks, just real savings. Enjoy lightning fast internet at home and reliable wireless everywhere you go, all backed by your local Twin Lakes team. Visit twinlakes.net to bundle and save today. Tri-Lite Mobile, better wireless from people who bring you better internet. First line free offer requires Twin Lakes internet service. Other terms apply. See twinlakes.net. Lace up your running shoes and celebrate the 4th at the 28th Annual DeKalb Fiddler 5K, July 4th at 7 a.m. in downtown Smithville. Rain or shine, be part of one of the biggest weekends of the year during the Smithville Fiddlers Jamboree while supporting Upper Cumberland Habitat for Humanity. This timed race is also a qualifier for the Run for the Cumberland Medal Series, so bring your best. Run, celebrate, and give back to the Upper Cumberland Habitat for Humanity at the DeKalb Fiddler 5K. For more details and to get registered, visit uchabitat.org.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, and we are back. I mentioned before the break that we were going to go ahead and talk about the 100-day myth. In Medicare, paying for those skilled nursing stays are not automatic. As I mentioned in the before break, it does require a 3-day inpatient stay. And once you're admitted into the skilled nursing, you need to be showing improvement for Medicare to keep paying, not just a Medicare Advantage. Now, your Medicare Advantage plans, they do like to try to get you out of there as quick as they can because they don't want to pay for those days. Medicare will cover up to 100 days. That's not a guarantee. But what the one guarantee there is with that 100 days is Medicare will pay nothing after 100 days. So if you're still in a skilled nursing facility, basically at that point, Medicare considers you a nursing home resident, and Medicare does not cover nursing home. It doesn't cover assisted living. Again, that's why we talk about the umbrella coverage. We have plans to help cover that. Also, the nice thing with a lot of those plans is for a small investment, I shouldn't say investment, I'm supposed to use that term. For a small monthly fee, you can get a lot of benefits. A lot of plans, they'll pay up to 360 days, and you can, we kind of use as a benchmark. We're not capped on this. We have some plans that'll go up to like 700, 750 per day. But if you're getting $400 a day of benefit, and you use all 360 days, you're looking at, I think I'm doing the math right. Maybe it's if we do that, but you're up to $144,000 of coverage, and and the beauty on that is that's not taxed. You're getting that benefit to pay for your health care, and you're not taking that money out of your retirement funds. So if you ever have to use that, who wants to blow $144,000 from their 401k or their retirement annuity, their IRA or something like that, when you can have a plan in place that helps pay for that? And I always say you don't have to be looking at Medicare to consider a plan like that. Now, some of the plans we have, you have to be of a certain age to get that. But then again, you also qualify for some other options when you're younger. I would love to talk. If you're 35 and starting a family, it's not too early to start thinking about to do some retirement planning. But it's not too late if you're over 65 either. There are still plans we can get. In the underwriting on these, is fairly simple. It's like 3 to 4 questions depending on the level. There's most of the plans they have that I just mentioned, they have 3 levels. And if you're going for that top level, there's another question, and it's like, hey, are you planning on having surgery anytime in the next year? It's about that simple. Now, they can turn you down if you have some major health issues or have had, depending on the company, whether they ask height and weight questions at all. So, as we say, everybody these days is overweight or a little overweight. That's not necessarily going to knock you out from one of these plans. But again, the younger you can get it, the less it's going to cost. And you can get a lot of coverage in place, as a young person, to know you're going to have something. And the thing is, you don't have to be in retirement age to be needing some of those skilled nursing benefits. Maybe you get hurt. You could get hurt on the job and be drawing short-term disability. But this would also pay you. Maybe you need some help around the house, and you could qualify to use it. So you don't have to be a senior to get this plan. The other thing is, the traps, or as it says, this is the way the notes are telling me, prescription costs traps. Plans change yearly. That's why we always encourage everybody in the fall, if you're on Medicare, get with us, let us double check, make sure you're still on the drug plan that's right for you. And it's a real simple procedure. You can just send us a list of your prescriptions, and we can check that out and see and say, yep, I think your plan is going to be fine, or hey, we think you should pick this plan, and we'll review your other policies at the same time and just kind of button everything up, because January rolls around and you didn't do anything to change your drug coverage. You've got that drug plan for another year, so it's really important we knock that out in the fall when we're doing the reviews. And the most timely part of it is for us is putting in your prescriptions and then doing that online search to see which plan is going to cover your prescriptions better and for the least amount of cost to you. And when I say the least amount of cost, remember, it's not just your premium, it's also the drug costs that you're going to have, because every company out there has a formulary and they don't have to cover every single drug. They have to cover classes of drugs. So, and just because your plan covers that this year doesn't mean they're going to cover it next year. Always be looking in the mail, and I know in September your mailbox fills up with crap. Because everybody's advertising, call this 800 number. Ignore all the ones that say call this number. That's the easiest way for me to put it, because if I'm your agent or you have another agent, that's who you call. Don't call those toll-free numbers on those flyers you get in the mail, because you're just going to get into a call center and they're going to convince you have to change, and maybe you don't need to change. So always work with your local agent. And if you don't have that agent anymore, or if you did sign up to one of those 800 numbers, a couple years ago, give us a call. There's no charge for our services. So, and no insurance agent is allowed to charge you for their services. So, but we'll make sure you're on the right plan for the next year. So if you didn't get that guidance before, it's not too late. But make sure you check with us. Now, the infamous donut hole, that did go away. There are still big gaps in your health, your drug coverage. And one of them I already mentioned is it on your carrier's formulary? And then we had the so-called Inflation Reduction Act, which put a cap on the maximum cost for your prescriptions. The first year it was $2,000. This year it's $2,100. Rumors kind of have it that it's not going to go up this next year, that it's going to stay at $2,100. And I've also heard people say it's going to be $2,400. So either way, there's going to be a maximum cost on your prescriptions. Here's where the big gap falls. For that maximum out-of-pocket to apply, it has to be on your plan's formulary. I run into that issue with people with insulin. They had that $35 cap on insulin, but it has to be the insulin that's on your plan's formulary. If it's not on your formulary, you're just going to be paying out of pocket for that insulin, and it won't count towards that max out of pocket. So you need to make sure your doctor is either prescribing the insulin that's on that plan, or maybe you need to change that plan so that you can take the insulin that your doctor says you should be taking. And that's just insulin. People have some of those brand name drugs that, maybe they don't cover it. What was the one I just ran into recently? I can't remember what it was, but it was like nobody covers it. No Part D plan covers some of these drugs, and it was inhaler. I just can't think of the name of it right now, but it was one of those things for COPD or asthma. I think this case was asthma. And now you can get what's called a formulary exception. It's going to make that drug cost a lot more, and you probably will hit that max out of pocket, because it's going to start costing you a couple $100 a month, because it's a $1,000 drug, and they're not going to cover it, on the lower tiers where it's less expensive. So that's the thing with the drugs. So you got to make sure it's on your plan, or it's just out of pocket. Now, of course, and like I said, the one that nobody covers, we've got my friends at the Canadian Med Store that can get a lot of these prescriptions filled for you for a lot less than you'd pay at the pharmacy. So that's something to look at, especially if it's not covered. If it's not covered on your formulary, but you still want to take that prescription, we can get it for less. I've even mentioned that you see all the TV ads for the GLP-1 products. You can get those through the Canadian Med Store. They're not going to be free, but they're going to be less expensive than you just going to the local pharmacy and paying cash for them. So take advantage of getting the savings. There should be a link on our website, or if not, we can email that to you. Just let us know, and we can try to get that out to you. So travel generally is not covered. So we have a lot of people that, they want to stay with original Medicare, get a Medigap, Medicare supplement plan to cover that 20% that Medicare is not covering, and that Part A deductible, so they can, typically snowbird. Here we got the halfbacks. We got those people moved from Michigan, they moved to Florida, and decided that the summers were just too hot there, and so they decided, but they weren't going to move all the way back to Michigan, so they settle in Tennessee. But if you're still snowbirding, going to Florida for the winter and coming back here for the summer, you probably are more apt to want to have a Medicare supplement. It's easier if you do a lot of travel. You're living the RV life. You're driving all across the country because now you've got the time to do it. I would recommend, in cases like that, have a Medicare supplement. Now, the good news is with the Medicare Advantage, you're always covered in an emergency. So if you did have a car wreck or something happened, you're in a campground and you got hurt or you got, have a heart attack, something like that, you're in network for that emergency. But once you get stabilized, but you're not ready to get out of the hospital, it's not an emergency anymore. So that's why a Medicare supplement can be very handy. And again, that's why those hospital indemnity plans can also be very handy to help cover some of those costs that might not be covered 100% by your insurance. So, but if you're going to stay local, or the other thing is, we always tell people when they're turning 65, if you can afford the Medigap, go ahead and get it then, because they are underwritten plans, but not the first 6 months that you're eligible for Medicare. They have to accept you. So we do that, and then we look at down the road. Those rates are going to go up on that Medigap plan. So a lot of people, the monthly premium now gets to be too much. You can always switch to a Medicare Advantage plan during the annual enrollment period. You can't always switch from a Medicare Advantage to a Medicare supplement because you may not be healthy enough now to get that. So you think, well, I never go to the doctor, I'm going to get a Medicare Advantage. That's great now. Things change. Everybody I know that's ever been diagnosed with cancer, none of them have ever said, I know I'm going to get cancer next month, so I better go see the doctor. They don't know why something's happening, or they find a lump, or they're feeling, why am I feeling run down? And turns out they have cancer or leukemia or something like that. No one plans for it. They don't plan for a heart attack either. They just happen. So just because you don't hardly ever need to go to the doctor now doesn't mean a couple years from now that's going to be the case. So those are some things we want to make sure. And again, if you're going to be local and everybody's in the network, a Medicare Advantage plan can be a very affordable option there. And again, I'm going to beat that dead horse. We never recommend a Medicare Advantage plan without umbrella coverage. So, and then one of the ones, the IRMAA surprise. I'm sorry, your income's higher, and the Social Security likes to look back 2 years, because basically, I use the example. Most people have got their taxes done now. This is 2026. If you came to me in the fall because you were going on Medicare, or even right now, you started Medicare this year, you hadn't filed 2025's taxes yet. So they base it on what you filed in 2024. So that's what we say is that it's a 2-year look back. It's always because you haven't filed that last year's taxes. So they have to go back to 2 years to get what your taxable income was. I always apologize to people at my workshops. Hey, I didn't know you 2 years ago, to tell you, hey, don't just cash out that 401k. Make sure you roll it over, because it could hurt you later, not just the tax when you get it. Remember, so Medicare does not equal full coverage. There are gaps, but we do offer a free Medicare review, free drug plan check, and we're a local help. We're not an 800 number. So give us a call, 931-881-3969. We're on South Jefferson next to the Domino's. Road construction's down that way. Is not too bad now. I mean, there's still a little. Probably the biggest issue is right there at I-40 and South Jefferson, and you can always go down 111 and come back up. So give us a call. Check us out on insurancematchmaking.com. Keep listening here to Grace 107.7, and we'll talk to you again next Saturday at 10. And remember, we don't sell you insurance policies. We match you with the policy that's right for you. And have a great week, and we'll talk again next week.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.